let us now embark on a journey towards fully understanding and destigmatizing mental health in this transformative session. And we have, again, a really good panel that's about to come up in front of everyone and talk about the importance of mental health. And please welcome the Assistant Commissioner of Bureau of Harlem Neighborhood Health, Padmore John. Let's give Padmore a round of applause. Up next, we have the Executive Director of the Association to Benefit Children, Dr. Eri Noguchi. Also up next, we have humanitarian, entrepreneur, philanthropist, survivor, and the Association to Benefit Children's Associate Executive Director, Brett A. Scooter. All right, and last but not least, the Social Work Manager for MSK, Dr. Linda Matthew.
Thank you, Elijah. Good afternoon, everyone. Thank you so much for being here. There's so much energy in this room. Harlem, what's up? Thank you for your energy. I have seen the way you have been moving for the whole day. We appreciate it. We appreciate you for being here. We hope to talk about a subject that sometimes is not often discussed in the African American community, but we hope to be able to do that today. We have some great panelists, so we're going to have them speak about some of the stuff they're doing, as well as being able to open it up to you for some questions. So I'm going to start right here with Eri first. Please, Eri.
Should I do the 5 minutes or make it shorter?
Yeah, do it 5 minutes. So we'll just give a background about each of our panelists, what they do, some of the specialties that they're involved with, some of the work that.
All right, so we were given 5 minutes, so I wrote stuff out so that I don't digress. So I'm Eri Noguchi, and I serve as the Associate Executive Director of the Association to Benefit Children. We provide early childhood education centers, Head Start, early Head Start, after school and summer camp for school-age kids, and a whole host of children's mental health services. We run 4 community-based mental health clinics in Harlem, as well as 1 in the South Bronx, and we're in 25 public schools with mental health teams on the ground. And one thing that I really want to make sure you know about, we run the Manhattan Children's Mobile Crisis Team. This is the team that you can call 311-988 or 188-NYC-WELL for any child who is experiencing a mental health crisis. Anytime, 8 a.m. to 9 p.m. we'll be there within 2 hours, wherever the child is, in your home, on the street, at a rec center, at school, and then overnight we make an appointment to be there first thing in the morning. Where the calls to this 188 NYC-WELL has gone up in the past 3 years. Padmore asked us to talk about what we're seeing in the community, and I think our other panelists are going to talk to you about this as well. Children's mental health needs are through the roof. We're seeing children who are attempting to take their own lives, children who are self-harming. I'm assuming many of you are seeing this as well. This is everywhere in every school we are. Refusing to leave their rooms, getting into fights. So many of our kids are just not able to tolerate emotionally charged social interactions. And so they're exhibiting acute emotional and behavioral distress. The good news is that we can make a difference. And so I want to just tell you 3 things that we do. The first and probably one of the important things is it's so important to bring the mental health services to where the kids are, right? Locating clinics in the community so that they're within walking distance. Bringing the mental health services to schools, because that's where most of our kids spend most of their waking hours. We'll talk about this a little bit more, but it's so important to add youth peers to the mental health teams. Youth peers are people with lived experience, lived expertise. They're 19 to 26 years old, so they can relate better to our young people. They can talk the same talk. And then most importantly, I think working together, locking arms, and finding ways to respond jointly to the kids who need us.
Good afternoon, everyone. So I am from Memorial Sloan Kettering Cancer Center, and the part that I really want to talk about really is racial disparities in healthcare. And for us as a department of social workers, what we're trying to do is really help our patients who are coming from communities like ours in terms of addressing racism, but also helping our other clinicians understand how racial trauma shows up in healthcare. And how we're doing that is our department is really focusing on shifting how we practice to become anti-racist practitioners. So our patients who are coming in who are saying, I have this mistrust, I don't know whether or not my team is hearing from me, we take that back and say, how do we advocate for this patient so their voice is heard? So we are spending a lot of our time saying, racial trauma is real. We're not going to pathologize it, but we're going to say we have to have people understand racism is real, it's a public health issue, and it's a mental health issue. And that is something that I am a serious advocate for in terms of our institution.
Thank you very much. I think it's really important for us to recognize the various ways that racism has an impact on our health. Being able to speak with our providers and making sure that they're listening to what we are saying. That's really important. So we'll dive into that a little bit more. Brett, please.
Good afternoon, everyone. Good afternoon, everyone. Are you happy to be breathing? Are you happy to be here? Are you ready to learn? Are you getting something? Yes, so that's the energy we need. My name is Brett Scudder. I'm a suicide attempt survivor and someone who has been through multiple types of trauma, near-death experiences. I've been in and out of the health and mental health system for many years. I wanted to be part of this because I want to talk with you about the experiences of suicide. I notice a lot of you in here are all young and beautiful. Look at all the young and beautiful people in this room. Wow. No one would ever know that you have children and grandchildren. Right? But here's the thing. I'm the president of the Suicide Institute and New York City Suicide Council. We're starting to see for the last 10 years children between the age of 4 and 9-year-old with suicide ideations, attempting suicide, telling their parents they want to die. Listen to me. 4 to 9 years old. 4 to 9 years old. When we talk about suicide, we've always talked about suicide from a death perspective. Only when a celebrity dies, right? Let's be honest. We never talk about suicide in our black communities, right? Even this morning, someone saw me on the train and they said, what's your opinion about it? And I told them, I said, black people don't kill themselves. I just looked at him and I said, you see, this is why I do what I do. We need to educate ourselves around not just mental health, but the experiences of depression, anxiety, loneliness, grief, and so many things. Linda talked about racism. So many people are struggling today. And that person may be right beside you. That person could be your father, mother, sister, brother, uncle, aunt, nephew, grandchild, grandniece. We are all on some level of hurt. Suicide is not just someone wanting to kill themselves. Suicide is an experience of people struggling with pain. Pain that is personal to them. Pain that is intimate to them. And as I said, a lot of you young people in here looking so beautiful who have children and grandchildren, what are you going to do when your grandchild comes to you and says, Grandma, Grandpa, Mom or Dad, I'm depressed, I'm bipolar, I feel like I want to die, I feel no value in my life and I don't want to be here anymore. What are you going to do then? I have been in the health and mental health systems. There is a lot of work that we have to do. That's why the work that we're doing today on this panel to bring education and awareness is for people to not go into the systems and come out worse than they went in. Okay? That's the reality for us as black people. We go into systems that exacerbates our pain. Next thing you know, we come out worse than we went in. and our whole lives and structure and social status and everything changes. So I'm happy to be here with my fellow esteemed guests. We're going to have that conversation. We're going to share some things with you. But one thing I want to take away from today, from this panel, is to think about your child, your loved one, your family member could be in crisis right now, and what you need to learn from us to be able to help your loved one.
Thank you, Brett. Thank you so much, and I appreciate the attention that you're giving to this topic and the information that we hope to be able to give. And of course, at some point, we want to be able to answer the questions that you may have, so please consider those. I will start with the panel by just saying that obviously to the point that you're making, Brett, how that we do need to help, right? And we need to be able to gain access to the help. So Erie, can you just talk to some of the barriers that you see that are there and how we might, and how to address those barriers, get around those barriers to get the help that is needed?
Sure. So 3 come to mind. I think that the one that, for any of you who have a child who needs mental health services, the biggest barrier right now is that there are wait lists everywhere. The children who have the most acute mental health needs, including suicidality, really need to be seen, treated, cared for right away. That then means that kids with more milder symptoms are relegated to these long waiting lists. And so they suffer for longer, but they're suffering nonetheless. That's a huge barrier. The other is stigma. It's gotten a lot better, don't get me wrong, but there is still, among teenagers, among middle schoolers, a feeling of, I don't need to go see somebody about my mental health. I'm not crazy. I don't need a shrink, right? There's a lot of stigma around that. And frankly, sometimes that stigma comes from their parents, from their families, from their communities. So we do need to help all of ourselves, the school communities, the kids themselves, to feel a little bit more open to the fact that we all have vulnerabilities and we, sometimes need professional or paraprofessional help. And then the third is, a little bit what Linda spoke to as well, is a lot of our clinicians don't look like or come from the same neighborhoods, the same background as our kids. And so the kids are like, how is she going to understand what I've been through, right? So we do need to really increase the representation among our mental health world.
Thank you, Ariane. That's a great point. So Linda, I would like to turn it over to you in terms of some of the health equity initiatives that you have been engaged in and how that might be able to spread across the system at all.
Thank you. I think I want to first start off with helping us understand the difference between equity and equality, right? It's very important there's a serious distinction, right? So mental health equity prioritizes social justice in healthcare. Mental health equality basically is saying we treat everybody equally. And we all know that last one will never materialize, right? Do you see the difference? So when you hear about equity, equity means how are we addressing what's happening in communities? For people from our communities that are saying we can't access mental health because of cost, because inadequate health insurance or no health insurance, or there's no providers, just as you said, Erie, in terms of who look like us. So how am I supposed to talk to that individual who's now going to diagnose me and pathologize me and give me medications, right? The one thing we can do, and we're doing it here, which I applaud the coordinators for this program, is you're letting everyone here know that mental health is something that needs to be talked about. Mental health is not a stigma. Mental health needs to be addressed simply for what even Brett said, right? If we're not talking about depression, if we're not talking about anger and anxiety that's coming up for us, it's real, and we hold it in our bodies, and it shows up in many different ways, including suicidality. So we want to debunk the thought mental health is a negative connotation and we should not talk about that in our communities. It should be brought up in church, in synagogues, in temples. As leaders, should all be talking about how do we support our communities, because I really believe in terms of health equity to happen, we need to make sure that our people are thriving physically and mentally, because when we're able to say that we thrive physically and mentally, it actually is like it's a harmonious thing that happens in terms of everybody kind of thrives and succeeds, right? So as clinicians, one thing I always say is the theories that we learned when we were in grad school or in doctorate programs, please take that away and look at the cultural in terms of that person. Who is sitting in front of you? Get to know them in terms of what's going on for them, because the culture really helps and shapes and forms that individual. So language matters. What language are we using? Are we using non-stigmatizing language in our medical notes? Because those medical notes get transferred from your primary doctor to a medical setting to another clinic. It's a system where it all goes with you as you go to a new physician. So language matters when it comes to health equity. Do we understand what implicit bias is? Do we understand, and I hate this term, but microaggressions, and that's what people use, but gaslighting, invalidations, insults. Do we understand how that shows up for us when we are in a system of medical care where you feel like this person has power over me in terms of diagnosing me mentally and physically? No, there's an actual way you can actually have a dialogue with them and say, please understand who I am, because I come from a place of mistrust, or I come from a place of seeing other people not be heard when I'm getting treated, right? That's how health equity happens.
Thank you. Linda, before I move on to Brett, I want you to make the connection to your role, especially at MSKC, which is predominantly addressing cancer treatment. So can you make that connection, please, for folks?
Absolutely. So we know, and I'm going to share this with you in case you don't know, there are significant racial disparities that we see in terms of cancer care. So, for example, a lot of men, black men, are diagnosed with prostate cancer at later stages. Why? Because of the stigma about actually going in to get the actual surveillance in terms of what that means to have a prostate exam. There's a fear associated with that exam. And we have to do better as clinicians, as medical professionals. We have to do better in terms of saying, how do we connect with you to say, this is for your health, this is for your community, this is for your next generation to understand, right? Women are also diagnosed at later stages. Black women are diagnosed at later stages. Why is this happening? Because here's the thing, and I said it before, talking about mental health is not a topic that's normally talked about in our communities. They talk about it in physical ways. Oh, I had a stomach ache. Oh, I had a headache. Oh, I just had a little bit of a pain here on my breast. Those are ways that because they don't realize the language in terms of mental health, they say it in terms of their bodies, right? It's somatic issues that show up. We, as the clinician, as the experts here, have to say, hold on, this is how they're communicating. Let's go a little deeper. Let's ask more questions about what that means for them in terms of how long has that pain been happening? Is it causing you to not get out of bed? Is it causing you to feel like I can't eat any food, right? Those are things that we have to look at and say, those are signs of possible depression, but let's ask more questions. Let's be more curious in terms of when that person is talking about physical ailments.
Thank you so much. Brett, this is often a topic that is not spoken about in front of large crowds. It's a quiet topic. There are folks that suffer in silence. And we know that's one of the hardest things to do within the mental health community is to be alone. So can you just speak to what you have been through? I know you are a survivor, you attempted. Just speak to that point of suicide and what you would like the audience to hear.
Yeah, so how many people in here are crazy? Come on, my crazy people, put your hands up. Put your hands up, crazy people. Where are my I love you. Oh my God, I love you. If you are not crazy, today, in this age, something is wrong with you. Okay. So we just took that out of the way. If you are not crazy, today, August 17, 2023, something is wrong with you. Yes. Crazy is sexy, crazy is cool, crazy is trendy, crazy looks good, all crazy talk good. All my crazy people, put your hands up. Thank you. Everywhere we go, we need to bring that energy to crazy. You gotta be crazy to get up in the morning when you don't even feel like getting up. You gotta be crazy in the morning when you gotta go on this public transportation hell and go where you need to go. You gotta be crazy, my sister, when the pain is so intolerable and you still get up and come to this event. You came to this event because you want to learn. Even though you were depressed, you were stressed out, your anxiety level was high, you felt like Jesus turned his back on you, God don't see you, but you showed up. You showed up. Mental health is our ability to function and cope with everyday life. There is nothing about the mental health definition that talks about illness or being crazy. The next time somebody tell you you're crazy, tell them thank you. The next time somebody tells you you're crazy, tell them thank you, because they don't know the hell you're going through. They don't know the hell you've been through. They don't know what you're thinking and how you're feeling, but you show up, you stand up, you're looking good. Look at all the good-looking crazy people in the room. Unfortunately for me, when I came out with my depression and my anxiety, a lot of people were like, no, something wrong with you. So they went left, right, back, front, everywhere. I was left standing by myself. I was dealing with a pain that I have never felt in my life. I've had multiple near-death experiences. I have scars from my head to my toes. I can tell you stories about my life that would have made you quiver and be like, how the hell is this man still alive? But it wasn't the physical pains that pushed me over the edge. It wasn't the physical pains that made me wanting to kill myself to end the pain. It wasn't the physical pains and the ways in which my network of people around me left me standing at my most vulnerable time. How many of us in here ever had somebody tell you, if you ever need me, call me? Come on now, let's be real. If you ever need me, call me. Now, if you do need them and you call them, how many of you get through to the person that you took? So let me tell you this. We are all struggling with something on some level at some point for some reason. I don't know what it is. My sister here, she looks so beautiful. I'm looking at her and say, wow, she's a beautiful black woman. But can I tell what she's feeling? Can I tell how she's feeling? My brother sitting down here, my brother, look at my brother. Stand up, my brother. Look at this brother right here, good-looking black brother. Can any one of you tell me how he's feeling? Why? Because it doesn't show on the outside. It doesn't show on the outside. So when we're dealing with our pain and our traumas and our loneliness and our grief and our anxiety, we're dealing with something that's inside. And you can't even tell the person next to you how you're feeling. You can't even tell your family member how you're feeling, because then they become the ones who even make you feel worse about how you're feeling. So then you feel even more lonely and isolated, right? So the conversation about mental health in the black community needs to start with us at home. We need to start the conversation with us at home and stop being judgmental of each other. Stop telling each other like, oh, get over it. Oh, why you feel so bad about that? Oh, suck it up and be a man. Take it like a man. We need to stop doing those things because that's what's causing a lot of the problems we're dealing with right now is we created the very same demon that is killing us right now. So how do we break that? When you go home today, sit with your loved ones and say, I want us to talk about our mental health. And from a male perspective, a man of color, a black man of color, male perspective, we as men of color do not get emotional support anywhere in our society. That's why the suicide rates are higher for men of color. The ways in which we attempt killing ourselves is the way that it is. And many of us are with intimate partners and family members, even when we try to kill ourselves and complete it. Just think about that for a minute. So crazy people, hold your hand up. Woo!
Thank you so much, Brett. And I think that's a legitimate ask. When you do go home, have that conversation. You're going to ask them how they're feeling. You're going to ask them how their day was. How is your mental health? Let's start normalizing that conversation so that we can
John,
have a little bit more.
Can I just
Please.
add to that?
Sure.
When you're having that conversation, and for men, crying is not a sign of weakness. So please, if you're going to have this conversation, let's be transparent. Let's have the conversation and support one another. Okay?
Thank you very much for that point, Linda. I do want us to at least, and we're going to get to your questions shortly, but before we do that, just to go to what are some of the new and novel approaches that you're engaging at your spaces in addressing mental health right now? Ari, can you start?
Yeah. So first of all, I want to say the other thing that gives me hope is working together, right? That if we lock arms together and come up with innovative ways, that all of these brains in one room can actually come up with new ways of connecting with kids, with families, with everyone in the community. So I really, and I have to say, Padmore John is kind of the epitome of partnerships. I mean, he brings the city health department to every community meeting, every community-based initiative, and really amplifies the initiatives that are on the ground. So thank you for that. So two things I want to highlight. One I mentioned, but I really want to kind of dig deeper. The addition of youth peers as real, that we think of youth peers as part of the mental health team. These are 19 to 26-year-old young people who've had mental, involvement with the mental health system themselves. They can talk to our kids in a way that many of us can't. They can talk about music, what's cool. I certainly can't talk about anything that's cool anymore. As you can see, the minute I try to be cool, I get shut down. But not only can they connect with these kids, but because they have the training, because they have the lived expertise, not just the lived experience, but the lived expertise, they're tuned into that kid so that when that kid is ready, or when that kid goes into that danger zone, that youth peer has the skills, has the knowledge, has the resources, has the connections to mobilize very quickly. So I think that's one of the things that gives me hope.
Thank you, Ari. As Ari says, he runs a few different facilities. One of those facilities is in our building on 115th Street and Lexington Avenue, and it is a breath of fresh air. Not just the space where they occupy, but the way they interact with the community, the way they are so culturally sensitive. It is truly something that we're greatly appreciated of, that is in our building, and we hear it all the time from individuals that participate. So please, after this, make sure you connect with Ari in terms of being able to have access to that service. Linda, just going to point the same question to you.
So I'm not sure if you really want me to answer this question because when it comes to theories, I'm a person that really wants to decolonize theories and interventions because I really think that, well, from my understanding in terms of when I went to school, they were created by Eurocentric males to subjugate black people.
I think we want to hear that, Linda.
Right? And so I am a person that, yes, I have my degrees in clinical theories and stuff, but the DSM-5, which is where we use our tool book to kind of diagnose everyone, I believe is a very racist tool book. And so as a manager, I'm always teaching my staff to take away what you learned. You're in a room with a patient. Social location, which is a term coined by Dr. D. Watts Jones, who works for the Ackerman Institute of Families here in New York City, coined this term. And a social location really is you showing up and saying who you are as well as a clinician in that space with your patient. So what is the identity that makes you, you? Let's talk about that. I'm going to make mistakes as your clinician, but I want you to correct me in the assumptions that I've made so we can then have a better and honest, organic dialogue in terms of how to support you. Because here's the thing. If we do not disrupt racism, racial trauma will continue to be transferred from generation to generation, right? So we have to come from a cultural perspective. It's a philosophy, right? We have to really, as clinicians, say, how do we show up and have the full humanity of that patient that's in front of us be in the room with us so we can take care of them, support them, and make sure that as they go through the healthcare system, they're taken care of, and they feel like they're taken care of, and they feel like they're seen.
Thank you so much. Brett, would you like to add anything to that? And then right after, we're going to go to your questions.
So one of the things that I did when I was going through my own challenges, I realized that the health and mental health system were really struggling understanding suicidality. I actually had a clinician tell me that if you feel so strongly about killing yourself, why don't you just kill yourself? So one of the things that I've been doing for the past 20 years is I've become the voice of someone who is not lived with suicidality, but living with suicidality. Every morning I still have to wake up and ask God, why do you still want me to be here? Why am I still here? Why, with all the pain that I'm going through, you still want me to get up, to show up, and to be up? And so in my work, every day I'm having these conversations all across the country, talking with people, normalizing crazy is sexy, crazy is cool. The next time somebody tells you you're crazy, don't be offended. You should be glad. Somebody said thank you. Who was that? Thank you. Right? We need to stop allowing our space up here to be cluttered with noise. Right? There's too much noise, too much chaos up here. And to you, my brothers, let me tell you something. I have had too many heartbreaking interventions with my brothers who waited until they were at stage 3 and stage 4 illnesses, and only because the doctor said, you are going to die, that they took their health seriously. But the thing that scares me the most about this, and I have experienced this myself, is how can you feel loneliness in an intimate relationship or a marriage? Does that make any sense to you? How can you feel lonely in an intimate relationship and a marriage? You literally laying next to somebody who you're intimately involved with in all kinds of ways, but the person doesn't know how you're feeling. The person doesn't support your emotional wellness and your emotional health. Your person cannot have a conversation that uplifts you when you're down, when you're feeling down, when you have a bad day. God knows for us brothers out here, the struggle is real, and we just wake up in the morning. We haven't even gotten out of bed yet. We haven't even gotten to the job yet. Just being a man of color is a struggle by itself. So to you, my brothers, I am telling you right now, and I'm giving you permission right now, just like me, don't be ashamed. Don't be ashamed to talk about feeling depressed, to talk about feeling lonely, to talk about wanting to feel like you belong. The biggest challenge for us is we're saving everybody, but we can't save ourselves. And there's nobody to save us. So expand that to the black community. If we don't learn to take care of ourselves and each other, who is going to take care of us?
Thank you. Very good points, very good points. We're going to go to questions. I see there's someone here with their hands up. Do we have Mike? We have 2 questions. So we'll start in the front and then we'll go to the back.
Miss, you can just ask the question. Just go ahead.
Hi, good afternoon. Thank you so much for hosting this panel. It's an important panel to have. My name is Sierra Scott. I'm the founder of National Clean Water Collective, and we recently hosted a forum focused on environmental justice, the intersection of criminal and racial justice or issues that are happening in our communities. Have you all looked at and the reason why we did that is because we were looking to understand the root causes as to why these things are happening. And we saw the intersections of why these things are happening as well. Have you started to look at the root causes as to why people are having mental health issues, more and more people every single day? Have you looked outside and you see garbage all over the place? And do you think that that bothers the mental health of people? Have you looked outside and thought when we had the air pollution that was happening, that probably could affect the way people were thinking and feeling? And even the social and economic, equity issue that we're having with black people. There are root causes as to why these things are happening. And if you're looking at those root causes and issues, I'd love to know what sort of programs you are rolling out to educate the public about preventative measures. Because we don't have to get this far in our sicknesses and illnesses if we use preventative measures so that we can be healthy. Because there was once a time when we were healthier. And now we are not. And so we have to look at those things. I just want to know, what sort of preventative measures are you looking at?
Thank you so much for that question. I think every single one of our panel moderators would like to take that question. I would also really quickly say I am from the Center for Health, Equity, and Community Wellness within the Department of Health. So that is something that is very specifically that we are doing and taking a look at the root causes, some of the challenges that we're facing. We have a table in the back room, Department of Health, and you can get some of the information about some of the stuff that we're doing that might be helpful in some of the court. But I'll turn it over to Erie and then Brett.
Okay. It's working? Oh, it's working now. So one of the things first of all, thank you for that comment. I think it's so important. One of the things that we have done is we've actually asked the kids themselves. We're like, why are we seeing such an increase in social isolation? Why are we seeing kids who are so depressed and so anxious and so hopeless? And what those kids are telling us is, listen, fires in other countries are polluting the very air we breathe. We're seeing heat that we haven't seen ever before. The other thing they do say to us is we're seeing very, very visible increases in drug addiction all around us as we go to and from the places that we need to go to. So the kids are like, we're depressed and hopeless because you're leaving us with a world that is kind of depressing. So, I don't necessarily have an answer to that, but I do think that it's our responsibility to fix this because they have a point.
So I want to add to that real quick, and thank you for your question. So just for those of you who don't know, one of the biggest threat we face right now and we're dealing with is this. Okay? One of the biggest threats that we're facing right now as a serious public health crisis is this. Too much access to information, unlimited access to information, a world where people are not nice, people don't care to be nice, all that. My sister, the reason why I made the point about just waking up in the morning is because we have identified all the things that you've talked about as reasons for anxiety, depression, grief, all these things. People haven't even left their homes yet. They already know their environment they live in. They know they got to take public transportation. They know they go out in the street, they're going to see poop on the street because some people don't clean up after their dogs. And then all these things around their environment. But to Erie's point, The other big thing that we're not paying attention to is how especially our children are watching and listening to a lot of content that is not helping their mental health. It's not helping their self-esteem, it's not helping them feel better about life, and it's not giving them a good look at the future. So we really need to start asking ourselves, how are we, this thing right here, how are we managing this in our homes with our children and even for ourselves?
Thank you so much. I greatly appreciate it.